Bismillahirrahmanirrahim. Assalamu alaikum. Welcome everyone. Today we are going to revisit the management of gastric contents aspiration in dental settings. We covered this topic previously, but this time the material will be presented in a different format. That is a flow chart. The information remains the same, but by using this visual approach, I hope to make the concepts clearer and easier to understand. Let's get started. Immediately stop any ongoing dental procedures. Position the patient horizontally on the right side to prevent aspiration. Clear the patient's airway by suctioning the oropharynx to remove any vomitus. Now there are two conditions. One is when the vomiting stops and no symptoms of aspiration are present. And the other one is when the vomiting stops, but symptoms of aspiration are present. So let's take this one. Continuously check the patient heart rate, blood pressure, and respiratory rate for 30 minutes. If there are any signs of aspiration, that is respiratory difficulty, wheezing, the patient should be transported to an emergency care facility immediately. Now consider the second condition. When the vomiting stops but symptoms of aspiration are present, call for emergency medical help immediately. Provide the patient with supplemental oxygen to maintain adequate oxygen levels. Initiate an IV line and administer crystallized solution, that is normal saline, at a rate of 150 ml per hour to support blood pressure. Continuously monitor the patient's vital signs, that is heart rate, blood pressure, and respiratory rate. Now there are again two conditions. One is when the signs of hypoxia are present and when there is no signs of hypoxia. If the signs of hypoxia are present, then you will take the following steps. Intubate the patient and perform a pulmonary lavage with normal saline followed by positive pressure oxygen. Administer theophylline 250 milligram IV slowly to help with bronchodilation. If the patient stops breathing, initiate basic life support. Ensure the patient is transported to an emergency care facility for further treatment. Even if there are no signs of hypoxia, the patient should be transported to an emergency care facility for observation and further treatment. The slides from 7 to 11 shows the steps we discussed earlier in a flow chart. Since we have covered all these points, so skip these slides. Let's quickly review the key points to remember. Gastric contents aspiration can cause serious respiratory difficulties. Particulate matter causes physical obstruction. High acidity of gastric material produces both serious problems. Low pH necrotizes pulmonary tissue, leading to respiratory distress syndrome. Patients with diminished gag reflex, with sedation, unconsciousness, oropharyngeal anesthesia are at high risk. Signs of respiratory difficulty include tachypnea, wheezing, tachycardia, and hypotension. Place the patient in head down, feet raised position, turn onto their side to encourage oral drainage. Use high volume suction to remove vomitus. Contact emergency assistance immediately. Provide supplemental oxygen. Monitor vital signs. Start an IV line. Administer crystallized solution to support blood pressure. Transport to emergency facility. To conclude, quick and appropriate response is crucial. Positioning and suction can prevent aspiration. Monitoring and emergency actions saves lives. Always be prepared for emergency transport. Thank you. Wish you best of luck.